Are you familiar with PRP therapy? How about shockwave therapy? My guest today and I break down the what, the why, the when, and as well as the who is and isn't a candidate for it. If you've got question about these treatments and certain chronic issues like plantar fasciitis, hip bursitis, or carpal tunnel syndrome, or you're interested in a little vampire facial action, this is your episode. I'm Deborah Atkinson. You're listening to Flipping 50, where I address your top struggles and concerns and really hope, most of all, to inspire you, change your expectations by raising that glass ceiling about what aging looks like. I share what to eat, how to move, and how to change your mindset so you can have the energy and the vitality that you want, need, and deserve. All right. In the show notes today at flipping50.com/PRP, I'm going to share a link to the 5-day flip, which is sponsoring this episode. And if you need to get started in exercise, might be a great and gentle start. My guest today is Dr. Sabrina Solt. She's a naturopathic medical doctor located in Scottsdale, Arizona, sweltering right here with me. She has been practicing regenerative and anti-aging medicine since 2013. Over the years, she's mastered various treatment modalities, such as prolotherapy, PRP, adipose and bone marrow derived stem cells, as well as birth tissue biologics, such as amniotic, allograft, and exosomes. She's known for crafting comprehensive and custom tailored treatment plans for her patients, which include things like diet and lifestyle changes, nutritional supplements, bioidentical hormones, peptide therapies, and of course, regenerative injections. In her free time, Dr. Solt enjoys reading, traveling, spending time with her husband and 2 adorable children. I can vouch for that. And her clients, her patients, come to her from all over the world. So if you're ever in Scottsdale in the area and you're thinking, there's something here, I'd like to see her, think about it. And don't you come here and not drop in on me. Let's get started. Dr. Solt, thanks so much for being here.
Thank you so much, Deborah. I'm so excited.
Well, so are my listeners. So let's, without wasting any time, dive right into it. So first of all, what is PRP? Let's start with the basics.
Perfect. So great place to start. So PRP actually stands for platelet-rich plasma, and it's a product that we get from the patient's own blood, and it is no more difficult than a simple blood draw. While it can look like we're actually taking a lot from you, the amount that we take in a single session is roughly 1/10 of what you would give in a blood donation. So relatively small amount, but still really sufficient for treating anywhere from 1 to 2 areas.
So what kinds of treatment, when you say treat any areas, what is it used for? Well, I mean, and there may be a whole list, but let's unpack that.
Yeah, so this is a really fun thing to unpack. So when we're talking about PRP and the potential that it has, we have to remember that what we're actually taking from the blood are all of the things that are responsible for actually doing healing and regeneration, right? So the way by which PRP works is the same way that your body heals. For example, if you were to get a cut on your arm, right? The blood would rush to the area. Certain things would be, growth factors would be released, cytokines would be released. There would be a lot of healing signaling going on. And that's the magic that we can put in a syringe with PRP. So the question then becomes, well, where can we put this? And my short answer, and we'll tease this out a little bit too, is pretty much anywhere. And your listeners can definitely use their imagination for this, but there really isn't anywhere that I haven't put PRP on a patient. So that being said, the most common things that we actually utilize PRP for is musculoskeletal injuries, things that didn't quite heal right the first time, or areas that have experienced trauma, degeneration, things like osteoarthritis, different bone spurs, ligament strains, sprains, muscle tears, basically any type of injury that is acute or chronic that doesn't fully require a surgery. That is definitely something that we can treat with PRP. A couple other uses for it. We can actually use PRP for a lot of beauty applications. So you can use PRP as a facial. Many years back, Kim Kardashian kind of made it very popular when she posted a picture of herself receiving, the term is vampire facial, right? Because they're pulling the blood for it. But that does involve a microneedling session of the PRP into the skin. And we can also do injections to actually enhance collagen production. We start to lose about 1% of our collagen every year, I think after about age 20 and 30. So, by the time we get into that middle age, there can be a lot of what we see as, sagging in the face and whatnot. And we can actually help correct that with just using PRP. Another thing that we can do is we can actually utilize it for hair loss. So a lot of the time women and men too, of course, start to experience hair thinning when we start to get into middle age, and also as a result of some sort of hormonal imbalances as well too. So a lot of times people with thyroid disorders will actually lose some of their hair, and we can actually help get that back with PRP. Another application with hair loss that's actually been happening recently is people who have had COVID do experience some COVID-related hair loss that we can help with doing those PRP injections too, which has just been really neat. Another application, and we can parse this out if you think your listeners would be interested, but we can actually use PRP for various aspects of sexual dysfunction for both men and women. So a lot of time women will experience kind of an atrophy of tissue as they start to get older. So things just aren't as juicy down there. Things, can be a little more painful when it comes to sex. It can also be a little more difficult to actually achieve orgasm. We can use PRP to actually get back a lot of sensation in the area, better blood flow to the area, which ultimately means better lubrication. And for men, of course, this can actually be a very viable option to actually help a man recover from erectile dysfunction. The PRP actually works to go in and heal and repair a lot of that vascular tissue that gets damaged due to, things like cardiac issues or diabetes issues, those underlying factors that will actually contribute to erectile dysfunction. So I know that was a lot. Before I go any further, I want to see if you have any additional questions on all of that.
Oh, I do. I was like, so I have two big ones. And so of course, I'm going right for this. So first, are there any negative side effects and downtime? But second, what's the pain factor, or what's done to make sure there isn't a pain factor?
Yes, great question. So side effects, I will say almost none. Now, I can't speak to every provider out there who is performing these injections, but the biggest quote unquote risk just simply comes from the person wielding the needle in the area that they're wielding it in. Otherwise, since we are using a product that comes from your own body, there's of course no risk of anything like rejection, and everything should be being processed in what we call a closed system. So nothing basically being exposed to any other products or anything that could get in the way. So the sterility should be very much maintained. That even being said, PRP is very, very forgiving as a product because it also contains white blood cells. So it actually kind of has a very antimicrobial aspect built into that. Now, as far as the discomfort goes, there are various ways of making PRP, so to speak. There's different anticoagulants that you can use to actually draw up the blood with, because again, we have to make sure the blood doesn't clot before we actually process it and deliver it back to the patient. And there are certain anticoagulants that some doctors will use that will actually produce a PRP that burns quite a bit. I do not do that. The way that I process it is with actually a heparin base of an anticoagulant. And that actually takes away any sort of stinging. So just like people right now can't necessarily feel the sensation of their blood going through their body because it's very pH neutral, same sort of thing when we're delivering a actual PRP injection utilizing the heparin as the anticoagulant. Very pH neutral, does not hurt at all. You simply feel the needle pinch. But there are steps that we can take to actually make that even more comfortable. We can apply kind of a topical numbing cream for certain injections. And then, of course, we can do things like lidocaine blebs and whatnot to just make sure that that tissue or area that we're going into has an additional level of comfort.
Sweet. Okay. So what about a number of treatments to experience benefits? And that probably is different for, say, say you're going to do a vampire facial versus we're using this for a muscular injury. I mean, what would be those two instances?
Yeah. So when we're actually talking about most of the aesthetic procedures, so the vampire facial or for the hair, we usually actually want to do 3 sessions of those spaced about 4 to 6 weeks apart. And with the vampire facial, that's something that a person could do after those initial sessions once a year as maintenance. I personally try to do one myself once a year, just to keep everything plump, looking nice and young, keeping those fine lines away as much as possible. With the hair, it's also important to do that because we want to make sure that we're getting those follicles in those different growth cycles. So again, series of 3 spaced about 4 to 6 weeks apart. And then you don't have to do maintenance on that, but of course, it's certainly not going to be detrimental to continue to just, again, enhance those areas with additional growth factors, especially if you're the type of person who has notoriously not had great hair growth. And I see this a lot in people actually who have underlying GI dysfunction or poor diet over time. Is, if you're not absorbing adequate nutrients to grow that hair, you're going to have much more of a tough time. Now, musculoskeletal issues. My whole philosophy behind any time we're trying to actually heal up an injury is that we always only ever start with one treatment because I need to see how you respond. Now, it's very, very rare that we get a patient who's a non-responder. And if something like that happens, I actually usually blame myself because it means that I must have missed something when I was doing my analysis. My whole goal when I'm assessing a patient is twofold. Obviously, I want to find the area that has the actual damage to it, but I also want to make sure that I'm honing in on the thing that is causing the pain. And this is an important distinction, and it's also important to loop these things together because we've seen just in seeing patients that something that pops up on imaging isn't always the thing that is generating the pain. I can't tell you the number of knees I have had in my office where they were told by their orthopedic surgeon or someone else that, oh, you have arthritis. That's definitely the thing that's causing your pain. Here, let's give you a knee replacement. 6 months later, they're still in pain. Why? The orthopedic surgeon likely never did a physical exam to actually parse out what the pain generator is. And when we're looking at a structure like the knee or a structure like the shoulder, these complex joints that not only have, of course, the joint space, but you have all the surrounding muscles, ligaments, tendons, and of course, nerves. All of those can be possible pain generators. So after my first session, we usually do a follow-up evaluation 6 to 12 weeks later. And the reason that we wait this long is because that's how long a healing cycle takes. We have to give the body time to heal. The minimum amount of time a healing cycle is going to take is 6 weeks. Usually around 12 is when we see really, really great results. So we reassess at that time. Say we get somebody 80% of the way better and they're happy with that, great. We're hands off. We don't have to do another treatment unless, of course, they maybe re-injure that area or they come to see me for a different area. If we get them 40, 50% of the way better, that might be a great time to do that second one. But again, we only ever start with one.
So good to hear. Yeah, I love that answer. That is so awesome. Who is a good candidate for PRP and who might not be?
Yes. So I'll walk you through my candidacy. And I'll kind of give some reasons behind all of these because there is a rhyme and a reason for them. First one is that I don't work with smokers. So this is people who smoke cigarettes, most tobacco products, and this has to do with a few different reasons. Biggest thing being is that blood flow gets so deeply compromised in those people that you actually have a very difficult time bringing blood flow to an area that actually needs to heal. And of course, that cigarette smoke can damage a person's native stem cells. They're just not great candidates for it. Also, people who have taken steroid medications within the last 6 weeks. Now, this is a temporary one, of course. As long as they wait that 6-week washout period, we can definitely treat them. But steroids actually suppress the necessary inflammatory response that we need to start a new healing cycle. To a lesser degree, anti-inflammatories or NSAIDs, non-steroidal anti-inflammatory drugs, those are going to be similar to the steroids. However, those only have to be stopped for about a week prior to treatment. I also don't want people to drink alcohol. Alcohol can also be very, very damaging to your platelets, to your blood flow, and just to your body's ability to heal in general. So we usually have people quit alcohol for 1 week prior to treatment and at least 2 weeks following treatment. Another kind of benchmark that I have for people is a BMI of 30 or less. And this is more so for musculoskeletal concerns. And it simply has to do with the amount of stress that can be put on a joint. Now, if we're, again, going back to the example of knees, every extra pound that a person carries on their body is an extra 9 pounds of pressure on the knee joint. When we start seeing people with BMIs above 30, which puts them in the fairly severely obese category, there's no regenerative injection in the world that is going to outperform simply the pressure of gravity. So if that's the case, we usually ask people to really work hard to try to get their BMI down to 30 or less, so that we can give their joints a better chance at healing. Besides those things, those are kind of the hard rules, so to speak. We also take care to evaluate other things like, does the person have an autoimmune disorder? And this can go one of two ways. If a person has an autoimmune disorder and it's very, very well managed, they're likely going to be a good candidate. If somebody's has an autoimmune disorder and they are in active flares, well, those active flares send out very inflammatory and signaling cytokines throughout the bloodstream. We don't want to take that hot and inflamed blood and then put it into a hot and inflamed joint. It's just kind of a recipe for disaster, and certainly not going to give us the results that we're looking for. We also do try to work with patients as well that don't have a lot of underlying conditions. Now, it doesn't mean that we won't work with you. It just means, again, we're trying to make sure that you are the most ideal candidate to get you the most ideal outcome that we can possibly get. So people who are dealing with things like diabetes or other poor blood sugar control issues, oftentimes will have a more difficult time healing as well.
Great answer. Okay. I'm just going to ask you this very open question. I'm drilling myself, or what else do I need to ask you? And why don't I just ask you? Is there another question that I should ask about PRP, or something else that you'd like to volunteer about it?
Yeah, I think that for most people, the thing that they do ask, and you kind of already touched on this, is, can PRP help me? And if a person falls into those categories, I always think that it is worth trying the regenerative options before you go under the knife. Or before you opt for surgery. And I think that this is important because I can't tell you the number of patients that have come into my office and I've treated another area of their body that didn't have surgery. They've gotten so much better, and they wish they could go back in time and say that and never have received the surgery and to have tried this instead. I always think that it's so important to keep your body intact, because once your anatomy has been artificially handled by a surgeon, whether it's cut or sewn or torn, whatever it is that they're going in there to do, it's never going to go back to how it was. And it's going to be a lot harder for the body to heal. And again, it doesn't always mean that we're going to get the pain away. And that's usually, again, the thing that's driving most people is getting out of some degree of pain.
Great answer. Okay, so I'm going to segue a little bit into this second kind of a new or alternative therapy, if you will, and that may not be the terminology you'd like, so correct me, but this actually came to my attention through one of our community members, and women in midlife were probably the most prone to plantar fasciitis of any population that I've worked with for 38 years. Numerous reasons why that is true. We won't go into that right now, but many of them deal with it chronically for a long time and don't heal it the way I would like to see them heal it, because sometimes they don't address those underlying reasons. But shockwave therapy has just come to my attention as another alternative and something to try. Can you explain, first of all, what that is? And again, we'll kind of go through the same drill, like when is it used, why, and how new is it? So am I just living under a rock, or is it new?
I would say you're living under a rock, but some of the earliest historical data from this actually says that it's been being used since about the 1980s. Now, of course, as far as it becoming mainstream, we're really seeing that a lot now. And this is a really great follow-up actually to the PRP conversation, because both of these things do work on the body's ability to heal itself. So the whole premise behind shockwave therapy is, first of all, it's not shocking. Nobody's going to get shocked during this. It is not painful at all. Sometimes people feel like a mild knocking sensation, but it certainly should not be painful at all by any means. Now, basically, you can adjust the settings on these devices to deliver certain types of shock waves, whether they're high or low, depending on the area that you're treating, right? So the short pulses are delivered, and you're delivering sometimes hundreds of these pulses in a single session, with the goal of them to basically kind of re-injure the area that you're treating, so the body is able to bring in more blood flow to the area. Again, all healing is blood flow. So the PRP, we're making more blood flow come to the area by actually giving it all of the ingredients that are present in the blood to start healing it. Well, shockwave is causing these very, very tiny micro traumas to that area to bring the blood flow so the body can start to heal the area. It often requires a significant number of sessions. We usually like to start with 6, can sometimes be upwards of 12. Again, depending on the person and the area that we're treating. But you can actually use shockwave for, like plantar fasciitis, of course, can be a really great indication. And as it kind of relates back to PRP, I've actually never had a plantar fasciitis case that wasn't cured with PRP, ever, like in my career.
Wow.
It's actually one of those things that's really, really easily treated. For some reason, plantar fasciitis and tendinopathies in the elbow are slam dunks, like literally 99.99% of the time. Anyway, we'll go back to shockwave though. But so of course the plantar fasciitis, but any sort of tendinopathy, any sort of ligament injuries, any sort of muscular sprains, strains, even non-healing fractures in people can be stimulated by these shockwaves. It's also actually very, very common to be used in men's health too. So in the mental health world, a lot of people have heard of the Gaines wave, and this is basically shockwaves, again, used to help people with ED. But overall, it's super non-invasive. So if you have the population of people that, okay, maybe they love the idea of stimulating their own body to heal, but they just really have a thing against needles, shockwave is probably going to be the better option for them.
Great indication. Okay. What precautions are there, or any side effects to that?
There really isn't much. It's like I said, it's a really, really safe area. It's a safe thing to do as long as you're applying it to these distal areas. So extremities, sexual areas. You of course don't want to apply it over any major organs or anything like that. But it basically just feels like a light vibration or a light pulse to the area, and it occurs relatively quickly. Usually treatments are no more than about 15-20 minutes. If it is a sensitive area, we can apply a topical numbing cream initially to just, make sure things are even that much more comfortable. And a lot of times people will notice changes in a couple of weeks after doing, our initial about 2 sessions a week for anywhere from 3 to 6 weeks.
So say that again. So I was going to ask, and I think you just said it. I just want to call attention to that. How much time between each session with shockwave?
Yeah, we usually like to do 2 sessions a week for a total of 6 to 12 sessions.
Okay. So fairly close together. And during that time, so say a woman has plantar fasciitis, that happens to be what you are using it for. Is she limited? Does she want to restrict her movement in any way, or just go about her business?
Yeah, and with plantar fasciitis, it can be really tricky because when patients are dealing with this, it's that pain when they first wake up in the morning, and it's kind of really excruciating as you start your day going, and then it can kind of dissipate as you're going through. And this is a really important thing to pay attention to. My general rule is if it hurts, don't do it. Now, it doesn't mean don't wake up in the morning and go about your day, but I certainly don't want people doing anything extra during the healing time to bring about that pain. Now, the goal, of course, is that morning pain upon waking is going to significantly decrease, over time. But at least when we're first getting started and going through these, any extra movement or extra activities that are bringing about that pain should be limited greatly.
Fantastic. Okay. Can I run past you just a couple scenarios and ask you if somebody presents with this? And of course, every individual case is different. We have to give you a get out of jail card. But what you might say, this might be the first thing that I would suggest, and then if not that, then we'd move on to this. Okay, so you've kind of walked us through plantar fasciitis. So I'm going to go back to that though, because I'd love for listeners to hear this. So your first step with somebody who presents and they've got plantar fasciitis and want to know what you can do for them?
First step is actually just going into their medical history a little bit more. I usually like to know all of the things that happened that led up to this. So the time of onset, what occurred to bring this on, what their normal daily habits look like. So what kind of shoes are they wearing? What kind of stress are they under? Have they had even a chiropractic evaluation or a functional movement evaluation to check posture? Or even if they are wearing the correct type of shoes. Because again, it's one thing to support healing the body. It's another thing to give the body the conditions to heal. So we really make sure that we're taking kind of a holistic look at the individual that's in front of us versus just pulling them in and just shooting them up, so to speak, or providing the shockwave. So we even go into things like diet, stress, mindset, medication, supplements, and start there as an evaluation so that we can make sure we're giving them not only, of course, the injections, but the best possible additional advice to make sure that we're creating the conditions for healing.
Perfect. And then would your first recommendation in general be PRP, given you've mentioned you've had great success with that?
In that situation, 1,000%, considering our only other options in the medical field right now are basically things like a cortisone injection, applying ice, taking ibuprofen. Ice is going to be palliative. Cortisone injections, I think we should just unpack this here for a second, are probably one of the worst things that you can opt for. And if you have opted for it in the past, there's no shaming here. We only do the best with what we know. But not only are those cortisone injections going to actually weaken tendons, weaken ligaments, cause cartilage to break down, they're going to leach minerals from your tissues, including your bones. They're going to tank your immune system. They're going to cause weight gain. There's going to be some other endocrine disruption. They're just bad news. And most of the time, they don't actually help anything, right? They might take away some pain, but just because the pain's gone, that's just kind of giving a person a free pass to continue to do activities that will actually worsen it, right? Because if you can't feel it, you're going to be pushing it further. So I really don't recommend cortisone. And then, of course, taking something like NSAIDs or Tylenol or any of these other over-the-counter pain relievers long-term, well, now you set yourself up for kidney damage, liver damage to the GI system. And of course, again, it is palliative with the possibility of it getting worse over time because now you're using it more because you can't necessarily feel that feedback from the pain, right? Pain is a very, very great teacher, and it's teaching us that there is something wrong that needs our attention, and it certainly doesn't behoove us long term to just try to push it away. We should be paying attention to it and working with it and trying to resolve the pain generator.
Great answer. Okay, there are two more that are very common that I see among midlife women, and sometimes a woman who has a tendency to get one she'll go one way or the other. She will become aware that it's a problem. She's got some kind of imbalance or alignment issue and needs to strengthen something, perhaps stretch something else. And that actually will be the best thing that could have ever happened to her. And then other times someone will deal with that chronically and not actually take care of the problem. But that is hip bursitis. So if someone presented with that, would they be a candidate for PRP or for shockwave therapy, or what would you recommend?
Yes, 1,000%. Hip bursitis is actually really, this is going to sound funny, but it's fun to treat because in these women, it's not normally the hip that's the problem. So one thing that your listeners probably don't know about me is I'm kind of a super nerd and I love puzzles and I love winning. And I apply both of those to the practice of medicine. So I learned early on in my career that bursitis presents, of course, as a hip issue. It's hip bursitis, but that's never what's actually causing it. So I get to go and investigate. Yeah. So is this a foot problem? Is this a knee problem? Is this a low back problem? And normally, again, once I'm doing my investigative work to figure out what's actually, again, generating that pain, causing that bursa to fill with fluid and get inflamed, we can treat those areas very easily with things like PRP. Depending on, again, what it might be, we actually might even consider something like perineural injection therapy, which is just another type of injectable that actually works really well to settle down nerve inflammation or nerve pain. And, nerve pain, of course, a lot of people have experienced. It's the burning, the electrical sensations, that kind of like numbness that can occur. And a lot of times that can kind of be party to those hip issues or those even low back issues. So that's another option as well.
Great. Okay. Last one is carpal tunnel. So a lot of women presenting with that, maybe fewer, I want to say, since the pandemic. Maybe nobody's really working at home anymore, but carpal tunnel for a while, it was like every other client I would see would be dealing with that. So what would be your first kind of line of defense for that? Of course, uncovering all the sleuthing cues that you would, but after that.
Yes. Okay. You kind of almost said it. Is the first thing with carpal tunnel is that you have to remove the thing that's causing it. So whether that's switching your posture at work or reinventing how you do a certain movement so that you're not aggravating that. But for those that don't quite know exactly what carpal tunnel is, basically there's a nerve that runs right up the center of the forearm, and it's the side where if your pump's facing up, that's the side that's facing you. And this nerve can get compressed, and when a nerve experiences compression or squeezing or basically anything that's aggravating it, it gets inflamed. And I didn't, it was great that I kind of led with the perineural thing as we're leading into this, because again, those perineural injections that actually settle down that nerve inflammation, phenomenal option for something like carpal tunnel. However, it does take multiple treatments. And this is something that, again, has to coincide with the actual physical changes in the person's posture, possibly even some physical therapy to go along with that to kind of get things back how they should be performing. Now, that being said, besides the perineural, so we talk about platelet-rich plasma, but there's also another component that we can get. It's called the platelet-poor plasma. And I kind of hate the name platelet-poor plasma because it makes it sound less important. But it's actually really, really rich in growth factors. And it doesn't come with as much of the inflammatory component that the platelet-rich plasma does. Now, the inflammatory component in the platelet-rich plasma is not a bad thing. We want that initial inflammation because that's what starts a healing cycle. But we can take that platelet-poor plasma, that very, very, very rich amount of growth factors that are present in there, and we can really bathe that median nerve in that, and it really, really helps to settle down any of that anger that it was pretty much experiencing from being compressed or squeezed by those muscles and tendons that are present in that forearm. It works phenomenally well. Of course, if you are going to be working with a provider to have this done, you want to make sure that it is getting delivered with ultrasound guidance, because there are a ton of structures in that area that you want to avoid.
Great information. Such a wealth of information on injury. Dr. Solt, where can listeners get more of you? Learn more from you.
So my website is stemcelltherapypro.com. The social media that I'm most active on is Instagram, and I'm just at Dr. Solt, so DRSOLT on there. I repurpose some of my reels and throw them up on TikTok. I'm Dr. Sabrina Solt over there. And I have a baby YouTube channel that I'm going to be focused more on growing in the next little bit. But if you just pop my name into YouTube, I should come right up.
So good. Okay, listeners, I know you're out there thinking, ask her about this, ask her about that. So if you want, you can leave your comment below the show notes, and that'll be at flipping50.com/PRP. And if we've got enough interest, we'll be sure to have Dr. Solt come back. She's got some things launching this fall. There may be other ways where you can get exposed to her and learn from her, or you can come see her here in Scottsdale. You can stop by and see me, spare bedroom, all the good stuff. So what are you waiting for? Let's start flipping 50 today.